So, super excited to be able to bring this topic to you guys today and to help hopefully empower you and give you some more information on how you can continue to resistance train or weight lift for many years to come and what kind of positive impact that can have not only in the gym but also on just your day-to-day lives and transition or transfer over into some of the other physical activities that you like to do, whether that's sports or hobbies um, or whatever you want to be able to do on a physical front. It's awesome to be able to have the capability to wake up in the morning and just to be able to have the confidence to know that you can go out and do what you want to be able to do or be there for those around you and not be limited secondary to declining health or decreasing functionality in your physical health. So, super excited to be able to bring you some more information on that front. My name is Dr. Jordan Adrian. I'm an orthopedic physical therapist who's been working primarily with active adults for the last 7 years and have seen people go kind of in either direction in terms of staying on top of things and doing some work on the preventative side of things and on the front end. And those who have waited a little bit too long and tried to fix things after they're broken and significantly have dug themselves into a hole physically. And my hope is that we can get more and more people to buy into the preventative health side of things and do work on the front end in order to help to maintain their physical health for many years to come. So, a little bit more about my background is that my first exposure to physical therapy was in 2008. I ended up in physical therapy myself due to an overuse injury related to baseball. Was blown away and thought it was really cool that the therapists were able to empower their patients or their clients to be able to help their body maximize its own natural healing process without really relying on more invasive technique or treatment options that we typically think of, such as surgery or injections. Or chronic use of medication to manage things instead of going after the root cause of why we experience pain or injury in the first place. My first passion is actually in nutrition, and being able to pair the two has been incredibly valuable. And seeing some of the synergistic effect between both physical health and exercise and nutrition can really just help to speed up people's results and get them to where they want to be ultimately faster and to maintain a higher level function for a longer period of time. I think it's really critical to be able to pair both education and theoretical knowledge along with practical application. And so over the last 14 years or so, I've gone through a series of different transformations and participating in different types of resistance training and try to pull best information and material from each of those different types of resistance training in order to help people achieve their goals faster. So um, both the bodybuilding and the powerlifting kind of initially, and seeing the connection between being able to lift some heavier weights and how that transfers over into to being able to build more muscle. With CrossFit, learning a little bit more about the gymnastics and Olympic lifting techniques, and then more recently getting into functional fitness, incorporating more mobility, more functional movement patterns with a little bit less weight, with squatting, deadlifting, lunging, things of that nature. Um, Going here, but more important than all of that is to start off with why it's so important to be able to help to empower people to take charge of their health. I've seen at this point in time people go down essentially two different paths and seen people that have been able to continue to move, put in some work and do the right things consistently over their lifespan, and they're better able to be able to serve their friends and family members in their community. If they want to continue to work, they have the ability to do that too as well, and continue to do their recreational activities, their sports and their hobbies that they find meaning in and that get them excited to wake up on a regular basis. On the other hand, I've seen people that have waited too long or had some other lifestyle habits that might not have been the best, didn't consistently exercise or take care of their nutrition. And they can get to a point where they start to lose their mobility, progressively have to start utilizing a cane or a walker. And they're not able to get out there and attend family events. Their careers can get cut short, and they can add additional financial stress to their lives, and kind of put them into a state of depression, or start to experience more mental health issues because of that lack of connection or that lack of feeling like they can provide for themselves or their family. And if we can head those things off ahead of time with a little bit of prevention, a little bit of education, overall, as a whole, we all benefit from that, and people are participating in society at their highest level too, as well. So on a personal level, and just showing that I've been there too as well in terms of coming back from physical pain and injury. Ended up in the emergency room in Winter Park about 5 years ago. Had 12 stitches and had to go through a whole process of allowing some initial inflammation to calm down, regaining the motion back in the knee, and progressively reloading and getting back into more functional movement patterns, such as again squats and lunges and deadlifts, and going through that process, but being patient enough to know that it does take time and the right kind of input or the right things to do on a weekly basis in order to eventually get back into the fun stuff. So, uh, been able to fully rehab that area, and love to be able to use that personal experience and stories to be able to help to inspire and motivate others to do the same. Yeah. So diving into more of the meat and potatoes, and to give you guys some background and context on common pitfalls that get people into trouble and ultimately achieving the long-term goals for their physical health that they set out to or that they intend to achieve. Um, Over the course of time as a society, we've been looking for quick fixes or cures for common ailments or for our physical health, or to allow us to live um, for for a very extended period of time in good physical health. Um, this gentleman in this photo is Juan Ponce de Leon, who's typically associated with the search for the fountain of youth. And throughout the course of human history, there's been many other civilizations and people that have been recorded as searching for a magical cure for physical illness and for longevity. And from a societal perspective, it's interesting to examine some of the causes of why that might be. But we do typically, as humans, as part of human biology, we tend to look for easier solutions or quicker fixes to problems, whether through gimmicky fit products, things like plastic surgery, or quick fixes in terms of medication or injections to take all of our problems away. But what I found over the course of time, and what the research kind of bears out, is that these these quick fixes typically have more long-term consequences. Things that are a little bit easier on the front end tend to result in hardship down the road. Um, and those things that are a little bit more difficult to do on the front end tend to help usually set us up for success, ultimately in the long run. So a little bit of that going through some pain, some difficulty, some growth on the front end ultimately helps to put us in a better place in the long term. So diving into what the literature tells us in terms of exercise and those who are active and who are involved in their communities and have meaningful connections, they found that you can reduce your mortality from all causes by up to 30 to 35% simply by being active on multiple days throughout the course of the week, and doing a combination of both resistance training as well as some light aerobic activity versus those who are completely sedentary. So, depending on what study you look at, that range as far as increasing your lifespan can be between a half a year and up to 7 years longer average. And those who are active are associated with a lower risk of several comorbidities associated with increased mortality or risk of death, including type 2 diabetes, heart disease, stroke, and cancer, and many more. Found this fascinating that after the age of 40, the average adult will lose 8% of their muscle mass every decade, which jumps up to 15% once we get into our 70s and our 80s. Um, and so, if we can imagine how that starts to impact our ability to navigate throughout the physical world and to be able to keep up in participating in our jobs and our recreational activities with our kids or our grandkids can have a significant negative effect if we aren't proactive about it. On the positive side of things, they found that up to 15 years of muscle imbalance loss can be reversible in as quick as 3 months of consistent training, focusing on strengthening as well as balance training too, as well. Okay. And then sarcopenia is a medical or technical term associated with the loss of muscle mass as part of the aging process. They found that things like chronic kidney disease, type 2 diabetes, and reduction in our normal hormone levels, or for women around menopause, can start to increase our loss of muscle mass and speed up this aging process, ultimately decreasing our physical function. Fortunately, they found that there are a few main steps to help us slow this progression so that we can stay as physically active as long as possible. Going back is to be able to maximize our nutrition as well as our exercise regimen, and making sure that we're focusing on exercises that are targeting maintaining and building muscle mass as well as balance. And then on a preventative side of things, getting routine physicals and blood work done in order to make sure that we're not having any other changes physically that could be impacting our ability to maximize these other two components. Okay, so again, kind of briefly touched on this on the last slide, but in order to help slow this progression on a practical standpoint is just making exercise to some degree a non-dated routine, being able to pick consistent time and consistent days that you have set aside or blocked off in your schedule to exercise is critical. And on days where you are busier, being able to at least get in, even if it's just a few minutes of exercise on those days, they've found that it can be incredibly powerful in habit formation and keeping us going in the long run. Because at the end of the day, consistency and being able to do things consistently over the period of a long period of time is what helps to yield results. We also want to make sure that our diet contains a healthy balance of both macronutrients as well as micronutrients, which are macronutrients are things like carbohydrates, proteins, and fats that help to contribute energy to our bodies to allow us to be able to function and have energy on a high level. And then our micronutrients are our vitamins and our minerals that will help out in metabolism and energy production, as well as helping to ward off some of the processes that can contribute to things like heart disease and diabetes and cancer. And then on the other side of things, we need to make sure that we balance things out and that we're sleeping well, we're recovering well, and we're managing our chronic stress. And then again, getting routine blood work and physicals can help to us to hone in on how well we're actually doing in implementing this stuff. Okay. So I do challenge you all to think about your physical health. And over the last year, a couple of years, have you started to notice any changes or decline or improvement in your ability to do the activities that you enjoy or do physical activities related to work, and how you've been able to tie in any of the other work or preventative stuff or things in the gym that you've been doing in order to maintain that? Or on the other end, what have you not been doing that you could work on optimizing? Okay. And then one of the first steps, and if you are to start a new program or start a new habit, is that acknowledging that change is hard and that as humans, many of us struggle with changing some of the things that we've been wired to do on a regular basis. But what I've found for clients and patients is that trying to really get to the root cause of why it's important for them to make this change at this point in time and what they ultimately hope to achieve can help us to be able to reverse engineer their exercise and nutrition program in order to set themselves up for success and to make sure that they're not always reliant on motivation or inspiration at any particular time, but that they're actually able to build up enough consistency because they have a strong enough reason why they started on this journey to begin with, where they end up developing habits that kind of carry them through to their ultimate destination or help them on their physical health journey. And then I challenge people to think about is the pain of staying the exact same, is it greater than or less than the pain of having to go through the process of going outside of our comfort zone and changing our habits? And in the event where the pain is greater in staying the same than it is in changing, then that's really when people are ready to be successful and to make changes in their health habits. And then, in order to increase your likelihood of achieving those goals, having somebody that's ahead of you a little bit, that's been able to do it, and then not only do it themselves, but help out other people in similar situations, can just help you to expedite the process, minimize the risk of setting yourself back on your journey, and ultimately serve as a guide to help keep you accountable and keep you going when things get tough. Yeah. So again, we talked about establishing why and why that's so critical. Being able to structure um, your day-to-day activities to where you have times blocked off to be able to exercise, to be able to maximize your nutrition, and then to really identify and be reflective on any gaps that you might have at this point in time that could keep you from getting to your goals, and then putting steps in place or reaching out to other people that can help to fill in those gaps so that ultimately you have more of an upward trajectory versus an up and down process where you feel like you're getting better and improving and then you're regressing and going through a cycle of kind of highs and lows in terms of your physical health. Okay. So from an orthopedic perspective, there are two main ways that injuries or pain typically pops up in terms of the musculoskeletal system, or in relation to structures like our muscles, our bones, our ligaments, and our joints. And the first way is through gradual stress, where we wake up one day or towards the end of the day, we just start to notice that we're having pain in our knee or pain in our shoulder or elbow, and there wasn't any one particular thing we can point to as a reason why that occurred in the first place. And in these cases, it's the gradual stress applied to your body is starts to become in excess of what your ability for your body is or that tissue is to recover. And so I always think of this in terms of an analogy of bending a pencil. So in this first example, if we were to really gradually bend that pencil for a long enough period of time and not let up pressure in order to allow that pencil to kind of bounce back from being bent into being straight, eventually that pencil will snap. Um, versus if we were to gradually apply pressure to it, bend it a little bit, but then allow it to bounce back, we could continue to apply stress to that over a long period of time without ever actually breaking the pencil. And in the second analogy, which is more related to an acute onset or a traumatic injury, we can think of taking the pencil and pulling rapidly on either end of it and actually forcing or causing that pencil to snap. Or in situations where we have a fall, we're playing like a contact sport and somebody runs into us and we end up getting injured right away. That force is, or that kind of trauma is too much to where it overloads our tissues and causes injury in the short term. So on the other end of things, how do I try and kind of prevent these things from happening or prevent getting injured? We found that identifying different imbalances in people's strength or their mobility or in the way that they're coordinating their movement patterns can be um, both positive and beneficial in terms of preventing gradual onset of pain as well as in some cases in preventing traumatic injury or reducing the impact of the traumatic injury when it does occur. We're able to gradually build up through things like weight training, our capacity of our bone, muscle, tendons, and ligaments to withstand more force and to ultimately not break. But it does take time and consistent effort in order to build up muscle mass and to build up resiliency in these tissues. And again, going back to consistency as being one of the main factors in helping us to stay physically active and to reduce our risk of injury over the years. Okay, so I get asked a lot of times, which types of movements should I focus on and where can I get the best bang for my buck? And I've really found and the research kind of bears out that functional movement patterns that are directly translate over into things that people do on a daily basis have the best carryover and ultimately help to improve people's lives faster. So things like squatting, deadlifting, lunging, pressing movements, and pulling movements focusing on the mechanics of those things first before adding too much weight onto them is super critical and can be super valuable when performed at an appropriate pace and with enough feedback to where we understand and maximize our movement patterns for our particular bodies. Okay, and then how much and how often should I get into the gym or some form of resistance training? For novices or beginners who haven't done any sort of weight training or resistance training for at least the last year or so, or maybe have never done it before in their life, 2 to 3 days a week can be plenty, can be more than enough to start building up muscle mass and resiliency in the tissue and they're going to get gains just from the fact that they're starting to challenge themselves in a way that they haven't in a long time or haven't ever. When we get into more of the intermediate stage of things to where people have been resistance training for 2 to 3 days a week for 6 months to a year, we can usually start to increase our frequency of sessions throughout the course of the week, closer to 3 or 4. We do split our workouts into more of like an upper body and lower body day or a pushing day and a pulling day. Typically, our body can recover a little bit faster and we can push more towards 4 weight training or resistance training sessions a week as opposed to 3. And then on the advanced side of things, after people have been weight training for multiple years, consistently for 3 to 4 days a week, it can actually push into more along the lines of 4 to 6 days a week, even breaking down sessions and having multiple sessions in any given day, and still be able to recover effectively in between those sessions. But again, it takes consistency and ultimately years of dedication to really fully reach our full potential. And then how many reps and how many sets should I do is something that people commonly ask and want to know a little bit more information on how can they optimize their training. So when I think of the hierarchy of needs as far as kind of what is most important in achieving our goals with resistance training or weightlifting is that again consistency is number one, but then volume is number two. And our volume of our training is our number of sets that we perform times the number of repetitions in those sets times the amount of weight that we use. So if we think of the example of a squat, if we're doing 2 sets of 10 repetitions with that squat and we're using 20 pounds of weight, maybe we're using a kettlebell or a couple of dumbbells with that, then we're going to calculate our volume by taking 2 times 10 times 20 pounds from there, which would come out to 400 pounds of total volume. again, in more the novice or the beginner population, almost any increase in volume is going to increase muscle mass and resiliency of our ligaments, tendons, and our muscles. But as we get more consistent in our training, we start with a lower volume of work, we have more room for growth, and that we can add more weight onto our bar or more heavier dumbbells, where eventually we can increase our number of sets from 1 to 2 sets per exercise, closer to 3 sets, to increase our overall volume and our overall challenge on our body, which is what allows us to adapt and to get stronger ultimately. We have found that as people do get older and are pushing closer into their 50s, 60s, 70s, and beyond, that it may not be entirely necessary to do really heavy weights with lower rep ranges between 1 and 3 reps or 3 and 5 reps, but a more moderate rep range closer to 8 to 12 reps or 12 to 15 reps or 15 to 20 can be equally beneficial in maintaining muscle mass while also decreasing the risk of injury and stress on aging joints. Okay, so on a practical standpoint, I like to kind of give people a perspective on the two different ends of the spectrum in terms of people who have taken charge of their physical health and made it a priority to do preventative things on the front end and kind of what their life looks like, as well as those who have been more sedentary and have tried to eventually catch up and try and save their physical health towards the end of their life, or have gotten to a point where they've just kind of physically given up and how that's impacted their lives. So on the positive side of things, I have the example of my past client Pete, who I like to say is 97 years young, and I say young because he's out swimming on a daily basis. He plays 9 holes of golf 1 to 2 times a week and actually walks the course while he's doing that. He works with two different personal trainers and does resistance training with them on multiple days of the week. And then he still likes to keep his mind sharp and active by studying the stock market and continues to invest at this point in time. And it always comes to my mind that he likes to make an emphasis that he's not necessarily investing for the long term at this point in time, but that he is addicted to the mental aspect of analyzing the markets and different companies too. So, and then when he did experience a flare up of knee pain, he was able to bounce back from that very quickly, reached out to me and had resources and accountability in ultimately overcoming it and got back into doing the things that he loves to do within a 6 week time frame. On the other end of things, use the example of my past client Irene, who never invested time or energy on the front end in exercising or optimizing her nutrition. Her strength and her balance started to decline, especially in her 70s and early 80s, as we saw with some of the previous graphs that we talked about earlier on in this presentation. She ended up suffering a fall and broke a hip as a result, and ultimately went from being independent and walking around without using any sort of assistive device to having to use a walker, and ultimately got weaker and weaker and had to use a wheelchair, and is increasingly more dependent on those around her. And she got to a point mentally where she was unable or unwilling to invest fully in rehab, and started to become and feel like more of a burden to those around her. So, um, so I like to use these two examples as well as the visual of diverging paths out in the woods to help to people to kind of wrap their mind around which path ultimately do they want to go down. Do they want to invest the time and energy and consistency and doing more work and having to grow a little more on the front end in order to have years of high quality of life and more of a meaningful life, to where they're empowered to do the things that they want to be able to do? Or do they want to take an easier route on the front end and avoid some of those things and have a sedentary lifestyle, but end up paying for it down the road from there? And I think on the surface level, it's an easy choice. But in terms of actually getting outside of our comfort zone and making it a priority and making it happen, accountability and having somebody that's ahead of you in the process and that has the background and experience of helping other people through that, as clients have found it to be incredibly invaluable and ultimately significantly increase their chances of achieving the results that they are looking for. Okay. And then a couple questions that I challenge people to ask themselves is to do a, a thorough audit of where they feel like they're at physically at this point in time. Do they feel like they will be able to continue to do some of the things that they're doing now, 10 or 20 years down the road? And then if not, how will this impact not only themselves, but the people around them, their friends and their family members? And what kind of impact will it have on their day-to-day life and their mental health and their stress level? And then to ultimately write down why it's important for you to be able to stay physically active and independent and capable throughout your lifespan. Okay, and then if you are a member of Combine Country Club, I am working there starting off on Wednesdays now between 9 a.m. and 3 p.m. We'll be doing 15-minute complimentary case reviews or injury reviews to be able to help give people clarity on where they're at in their physical journey at this point in time and kind of give them a recommendation, whether that's working together directly or pointing them in the right direction to help them get the resources that they need to ultimately increase the likelihood of them achieving their goals and continue to be able to improve and maintain their quality of life for years to come. We're also will be doing more physical health screenings to where we'll be able to, instead of doing it like a physical where you go into a medical doctor's office, we'll be able to give people a baseline of where their physical health is at this point in time, as well as some potential things to look out for to where people can kind of catch injuries as much as possible before they occur and do things kind of on a preventative standpoint in order to minimize that risk of having those things happen. So we'll be calling these active living evaluations, and those will be available under scheduling under an initial evaluation on the Combine Massage and Bodywork um, website with a link listed down below. And then for those of you who, again, are members of Combine, do have a follow-up talk scheduled that's going to be more physically active and more of a movement-based workshop. We'll go through some of the movement patterns like the squat and the deadlift and the lunge and overhead press in person, and help give people clarity and some more information on what they might be doing at this point in time and what they can do to improve their mechanics as well as when it makes sense to actually start loading those movement patterns on a higher level too as well. So I just want to leave you guys with one of my favorite quotes, which is our our greatest wealth in life is our health. And for those of you who have had that taken away for a period of time or seen other friends and family members who their health is rapidly declined, that they've seen how that's negatively impacted all of their other aspects of their lives, their relationships, their monetary wealth, or their ability to work too, as well as their mental health. And so I love to emphasize this point and think it's incredibly powerful to reflect on and prioritize our health so that we can be there again to better serve those around us and to better take care of our own mental health in for many years to come. So thank you guys for taking time again out of your day to further your education and to empower yourself more in relation to your physical health. And again, I'm hoping to do a follow up, or we'll be doing a follow up on this talk coming up in about a month. So stay tuned for that. And again, if you are a member or part of the community at Combine Country Club, go ahead and come out for that next movement based workshop. Would love to be able to meet with you guys directly in person and help to give you guys some more guidance and clarity on where you're at in your physical health journey and where you can get to if you have the right resources and the right mindset going into it too as well.